Hello, I'm Ray Bloom, and today I'll be presenting the NaloPack, which is an exploration and design for harm reduction. 80,411 people in the US died of opioid overdose in 2021. 88% of these involved synthetic opioids such as fentanyl. Fentanyl is 50 times stronger than heroin, and of laced pills seized by the DEA, 7 out of 10 contain deadly amounts of fentanyl. What are some risk factors? So combining with alcohol, combining with other drugs, unfamiliar environments, new people around, new suppliers. And these are also common occurrences at nightlife events. Luckily, we have a medication called Naloxone, which has become increasingly available and accessible even without a prescription, which can prevent death from an opioid overdose when administered in time. So we don't just have a drug abuse problem on our hands, we have an emerging accidental and avoidable death problem that is worthy of innovative solutions. The recent spike of fentanyl-related deaths, World Public Health Organizations such as the CDC and the WHO are urging people to partake in harm reduction by carrying Naloxone. You've likely seen these signs around. Both health organizations and informed partygoers have a need and a want to increase Naloxone carry. Yet, the informed partygoer isn't taking Naloxone with them because they are experiencing barriers to carrying it when going out. Looking at available products, there is clearly a missing need for visible yet elegant Naloxone carry solutions. Informed partygoer takes pride in harm reduction, but lacks a Naloxone solution in line with their need for both a visible product, yet something they'd actually want to wear out with them. Originally, hard good solutions were explored as a way to easily add Naloxone to a keychain, but it proved to be too bulky for multiple doses, and thus it made more sense to embed Naloxone into objects that are already being carried to events. Looking around, crossbody bags were the most trendy and popular object for people to carry to these events. So I started to explore fashion solutions in which Naloxone could be integrated. So what could the future of nightlife apparel be when designed for harm reduction? So in order for Naloxone to be effective, there are a couple conditions that must be met. One, there has to be other people to administer. When Naloxone is needed, the person who needs it cannot self-administer, and there must be people around. Two, it must be rapidly available. It's not just the difference between life and death, but the difference in quality of life after being revived. Because the longer the body is left without oxygen, the worse body systems will fare. And three, there has to be enough doses to revive someone, and it often takes more than one. So as an individual, this world can feel disempowering. But imagine getting ready to go out and knowing that you could potentially save a life. The pack must also be visible in all conditions, as there's a variety of lighting conditions at events. And because of this, the graphics are all glow in the dark. And because of the speed at which Naloxone must be administered, there's quick ergonomic pull tabs to quickly release the medication, and there are some graphics to give a quick start on how to identify an overdose and administer Naloxone. And there has to be enough doses. So this product is the maximum for many festivals for bag allowance and carries the maximum amount of doses that can reasonably fit in this footprint and is the minimum recommended for carrying. Because this product is about harm reduction, it goes beyond just Naloxone, because harm reduction is bigger than just Naloxone, which is why it also contains pouches for fentanyl test strips and condoms. This product works on two layers of social impact, the rapid deployment zone and the education. In an ideal world, you would never have to administer Naloxone. In this case, even wearing the bag can create social impact because it provides an opportunity for spontaneous education. The education zone is close enough to the bag that people can perceive it, and this has two functions. One, to ask questions and facilitate education, and two is to help people build a map of who has naloxone at an event, in the same way that people may take note of where the fire exits are in case of an emergency. In the future, they may take note of who has naloxone in order to respond quickly to an overdose. The deployment zone is the area in which naloxone can quickly be administered to someone in need. Depending on the density of the event, this could be shouting distance, throwing distance, or running distance. So what if 1 out of 50 event goers carried naloxone? We keep everyone safe. Current prototype build and testing phase is being wrapped up, with final details of the product being realized in preparation for next season, which will be the business planning, IP development, running a design probe to collect some testing and evaluation, and materials and process optimization in preparation for CreateX launch in the summer. Thank you so much.